Okay, so now we're going to talk about Chapter 24, Simulation and Nursing Technology. Um, so, okay. The use of latex-based and virtual simulation, virtual worlds, game mechanics, and nursing education is increasing, right? We have lots of schools and education departments that employ people specifically for these techniques so we could provide efficient, effective, and engaging educational experience. Because the bottom line is we need more nurses, we have more students, and we have less money and even just less support. It's hard to go to hospitals and get clinical sites just to learn lab. We're not allowed to practice on each other anymore. It's against the law, so we have to use simulation. And I remember when I first started, I was bummed that we weren't going to, that they were just starting sim labs. And now I think those are great. Sim labs are great. I'm so glad I got to practice putting in NG tubes and Foleys and all that stuff before I had to practice on a real person. And for those of you who never had sim labs and went straight into it, I'm sure you could weigh the pros and cons on both, right? So simulation labs are really important. In fact, people spend years just researching and getting their doctorate in sim labs. That is a specialty that you can go into in education, um, both in academia and in organizations. So there's benefits to these educational modalities. And simulation study brought national attention to meet the need and enhance, extend, or replace clinical and practicum hours because we have to. So this chapter, we're going to explore simulated documentation, clinical, virtual world, and game mechanics, and how we teach nursing informatics and nursing education. So we're going to describe the role of simulation, differentiate between the types of simulated electronic health records, identify the limitation of using a live clinical information system for educational purpose. And we're going to differentiate between live clinical information and simulated. So you complete your documentation in the patient's EHR and the simulation scenario ends and the debriefing begins, right? An instructor provides feedback on not only actions that were taken within the simulation, but also on the use of the EHR, which is important. So I'm going to tell you, if you go to NP school, your training is going to depend a lot of you on understanding certain things. So when you get out of school, they're not going to be like, here's lots of orientation time on using the EHR and implementing that into your care, which is actually a clinical skill. So when you have simulation that allows for this, it's going to better your ability to transition into the clinical workplace. And the same goes for nursing in general. They taught us to write these long SOAP notes and how to take verbal orders and blah, blah, blah. That's obsolete. I mean, obviously you need to learn a little bit of that because there's still schools or still facilities who use the paper charting, but that will be completely out soon with the HITECH Act. So we have to get involved there with EHR. So nursing informatic competencies in nursing education. What best practices exist so that students become prepared in informatics? So, what do we do in our teaching facilities to make this the best? So we get best practice. We have simulation ACLS codes, right? We learn how to use EHR. We have practice EHRs. We have practice dummies to give shots on. So 50 to 60% of respondents said that informatics was integrated throughout their curriculum and that experience with nursing informatics was provided during your clinical rotation. Well, I hope so. Now, if some of you went to school when informatics really wasn't a thing, like when I went to undergrad, no one really talked about informatics, that might not happen. With emerging technologies in nursing and healthcare education, the use of simulation to allow students to actively use informatics is authentic. So you might find that in a class, you'll have case studies delivered through your EHR and you'll have to chart based on that. That's a really great simulation competency. So in the late 1990s, it was identified that healthcare professionals needed to possess both skill and knowledge for informatics. And information technology was identified as key to improve safety and quality care, right? That's why we use technology. We use it to document, create care plans, to value, knowledge for practice and skill development, and then for data entry. So as a response, they started talking about how we need to teach research-based informatics competencies in school. So now it's really important that we prepare nurses in informatics. So here's a case for simulation. Simulators encompass a broad range of devices, including but not limited to, so partial task trainers, such as an IV insertion arm. This is how I learned. I actually got to learn an IV insertion arm, and then we went and practiced on people. Screen-based simulations, including simulated EHRs. I never had that. Simulated environments replicating a realistic patient care area. Now, we do see that with ACLS and more in the nursing classroom. And then patient simulation mannequins that can just be really real. They can bleed and they have different issues. And yes, is real hand practice the best? Absolutely. But this will prepare you for that better. So considering the realistic nature of simulation and its hands-on approach to learning, it seems that the use of simulation can be powerful in moving student nurses as well as any practitioner toward achieving the informatic competency. So how do we incorporate EHRs into the learning environment? So part of it is, So part of it is considering how we're going to do it. So can the EHR be created specifically for simulation? And what kind of simulation do you need? And then can it be used for real EHR system, either within hospital-based? And if so, how do we make sure we differentiate between that? So there's certain advantages and disadvantages to each simulated documentation solution. Live documentation systems provide learners with that realistic experience, but practicing helps. So we can make these real-time practice areas that help with efficient feedback, and they're designed to work in real time, which is great. But of course, for any of you who've done like your EPIC training or something, you know that it's not really realistic, right? But it is more helpful than diving in without having any other training. So the adoption and use of simulation technology presented a lot of advantages and disadvantages. So when you use simulated medical records, either as standalone learning or in conjunction with another scenario, provide the learning opportunity for hands-on experience, right? And I would love to do that when I train the new MPs who come in. I would love to be like, okay, here's your fake epic and here's a fake patient, and let's get through this one visit and see how you do. And that would probably improve the way that we integrate new grads. And that's definitely an area of research. So if any of you are looking for an area of research, we can do that together. So some major considerations when you look at simulated EHRs: cost, the ease of use, because if it's not easy to use for instructor and learner, it's not going to be used properly and it's going to be a waste of money. What kind of support do you get from the vendor, and what kind of support can you afford from the vendor? So we use Epic where I work, and Epic is great. I love it. A lot of people don't. It's kind of like love or hate. And I like it definitely more when you work in an area that has better support. So basically on-site IT people who are just Epic based. Time to build or develop the patient database. So you can't just go in it and not have like good case studies ready. Additionally, simulation materials included with the package, so you want to check and see what they have. And then flexibility of the system to be customized to what you use. And then overall fidelity and realism. Is this really realistic? So there's 7 key steps that are established to meet the 10-year vision of the Tiger Initiative. And the Tiger Initiative was a coalition that consisted of a bunch of experts in healthcare, informatics, business, industry, nursing. And the aim of it was to advance the integration of informatic competencies into education so that you could give better care and safer care. So the steps were to, there are 7 key steps, and the particular one is to take an active role in designing and integrating the informatics tool that are intuitive, affordable, usable, and responsive, and of course, evidence-based. And this approach helped promote new and innovative strategies. So what does the future hold for nursing informatics education? So simulations clearly is going to play an important role and will be helpful not just in education, but also in training. And eventually we're going to be so much more prepared when we get into a clinical setting. So for any of you who are frustrated with your clinical, oh, I just didn't learn anything until I got into role transition. Imagine if you got to really immerse yourself into that role transition or your clinical time before you even got there because you had so much time simulating.